Hi, everybody. I am Dr. Mary Claire Haber, and I am the creator and founder of the Galveston Diet. I am here today on a break talking about magnesium deficiency, and magnesium supplements. Everybody wants to know supplements because it is very overwhelming and confusing as to what supplements might be the best ones for you if you consider supplementation. So first, we're going to talk a little bit about magnesium deficiency. So there are some pretty important signs and symptoms of magnesium deficiency. And for those of you on TikTok, hear me. Sometimes we have some audio issues. I'm talking to two platforms right now, both Facebook Live and to TikTok Live. Just give me, just comment below if you have any trouble hearing me. Let me know, because the way I have to set the cameras up, yeah, the fan is on. Never mind. Let me. So I am going to be talking about. She hears me fine. You can hear me. Okay, great. If the volume gets, I think it's going to be an issue because the fan's kicking on my laptop. So I'm going to just talk to, so you see me glancing two different directions. That is because I have, let's see if I can do it this way. That'll work. That way I can look at, sorry guys, both cameras at once. So, okay, that should work out fine. So signs and symptoms of magnesium deficiency. So one of things that you know, so magnesium deficiency or hypomagnesemia is the doctor word for it, is an often overlooked health problem. 75% we estimate of Americans are not meeting the minimum recommended intake. And so most of you who follow me are 30 or above. So for women, that is going to be 320 milligrams per day. That's between food and supplementation. And then for men, it's going to be 420, in case any random man is watching this. So, and we will get, I'm going to be talking about different supplements at the end because they have very different uses. And so it's really important. And I made a TikTok about this as well. I will post the TikTok on Facebook, but it's super important that you guys know that not all magnesium supplements are equal, and they have very, very different uses, medicinal uses in the body. So, so everybody, good morning. Let's see. So one of the main things that we notice when people have a magnesium deficiency is muscle twitches and cramps. Muscle twitches and cramps. In the worst case scenario, a severe deficiency, which is rare if you are well and eating food every day, that you could even have seizures or convulsions. These symptoms, we believe, are due from a greater flow of calcium into the nerve cells, which overexcites or hyperstimulates the muscle nerves. So supplements can help relieve the muscle twitches. I'm reading my notes. And cramps in individuals with a deficiency, but magnesium supplements in and of its own are not the most effective treatment for severe muscle cramps in older adults. Remember that muscle twitches can be caused from multiple different things, and twitches are different than cramps. Cramps are like Charlie horses. That's what I'm talking about. Twitches are like when you have those involuntary, I'll get them around my eyes sometimes. So muscle cramps and twitches are one sign. Here's another one, number two, mental health disorders. And this is a big one. And I'm going to talk about which supplements treat which conditions. And it turns out that the mental health disorders are another possible consequence of mental health deficiency. This includes apathy. So it's kind of a lack of emotion or mental numbness. And also people, they did studies of people with depression, and people with depression tend to have lower magnesium levels than people without depression. And so there is some speculation that magnesium deficiency may promote anxiety, but sorry, my lips are dry. More studies need to be done on that before they can make a definitive conclusion. So number three, especially for us women in midlife, as most of you who follow me, osteoporosis. So we know that numerous risk factors contribute to the development of osteoporosis: aging, lack of exercise, poor dietary intake of vitamins D and K, and also of magnesium. Deficiency can actually weaken the bones directly, and also help lower the blood levels of calcium, which are critical for keeping our bones strong at this age. So I will get to magnesium supplementation. Everybody hold on. We're getting there. So number 4, muscle fatigue and weakness. Fatigue is characterized by physical, mental exhaustion and weakness. Everybody becomes fatigued from time to time. That is normal. However, it just means you need to rest. However, severe or persistent fatigue is usually a sign of a health problem. It's very nonspecific, but magnesium deficiency is definitely one of the things that can cause muscle weakness. Number 5, hypertension or high blood pressure. Animal studies have shown that low magnesium deficiency may increase blood pressure and promote high blood pressure, which is, of course, a strong risk factor for heart disease. Several observational studies in humans suggest that low magnesium levels or poor dietary intake actually have a much more increased risk of elevated blood pressure. Number 6, asthma. So asthma deficiency is seen in some people with severe asthma. Additionally, magnesium levels tend to be lower in individuals with asthma and in people who do not have the condition. So interestingly enough, an inhaler with magnesium sulfate, sometimes given to people with severe asthma, can help relax and expand the airways. How about that? For those with life-threatening symptoms, injection are always the preferred method of delivery, of course. And number 7, finally, an irregular heartbeat. So a heart arrhythmia or irregular heartbeat is among the most serious conditions of a severe magnesium deficiency. This is a medical emergency. Symptoms of arrhythmia, thank God, are mild in most cases. Often, though, it has no symptoms at all. Some people, you may not know you're even having heart palpitations. So symptoms of arrhythmia may include lightheadedness, shortness of breath, chest pain, or frequent fainting. In the most severe cases, arrhythmia may increase the risk of stroke or heart failure. Scientists believe that an imbalance of potassium levels inside and outside the heart muscle cells is to blame, a condition associated with the magnesium deficiency. So magnesium supplements have been shown to reduce the symptoms of people with arrhythmias. So, okay, so how do you get enough magnesium? So most of you are 30 or above. So as I said before, if you are a woman, you're looking to get about 310 or 320 milligrams of magnesium per day. That's between food and supplementation. If you're a man, it's going to be 420 milligrams for everybody 30 and above. And that tends to be my audience. And if any man happens to wander across my page and watch, I'll just throw that information out there. You guys need a little bit more. That's a combination between food and supplementation. So how do you know if you're getting enough in your food? Well, that is going to take some tracking, okay? You're going to need to track your food intake. I recommend something like Chronometer, Carb Manager, MyFitnessPal. There's a lot of great tracking apps out there. Track your food intake, honestly, for 1 week. Be absolutely clear about what you eat, what you don't eat. Get it all in there. And then you can look back from day to day, and it will tell you, what percentage of your RDA, recommended daily allowance, did you hit? And you can look back and go, you know what, I'm consistently low in magnesium. I'm not getting enough. So what can you do about that? Well, Dr. Haver, me, always recommends food first. You need to try to get the bulk of your nutrition from whole, real food before you supplement, okay? So almonds, a serving of almonds has 286 milligrams of magnesium. That's almost all you need per day, okay? Pumpkin seeds have 535 milligrams per serving. Dark chocolate, greater than 70% cacao. Watch the added sugars, guys, and watch the additives. But dark chocolate has 152 milligrams, peanuts 168, and popcorn 154. So it's really possible through just good nutrition that you can get all of the magnesium you need. However, sometimes we need to supplement, right? Supplementation is not for everyone, only for people who have deficiencies. So now hold tight and get out your pencils because you're going to want to write this down. There are multiple different types of magnesium supplements out there, okay? And they all have different uses and different side effects, so hold tight. All right, number 1, the most common supplement out there is called magnesium citrate, mag citrate. So it's bound with citric acid. The acid is found in citrus fruits. So this type is among the most bioavailable, meaning you eat it, you ingest it, and it has super high levels in the blood. Low bioavailability means you ingest it and it's much harder to detect in the blood. So mag citrate, super common. It's easily absorbed, easily digested. It is taken orally to relieve low blood levels. However, magnesium citrate has a powerful laxative effect. Okay, it is used to induce diarrhea for people having a colonoscopy. Okay, so sometimes you'll be given go lightly or like a gallon of magnesium citrate in order to induce diarrhea so that you can have a clean bowel to have your scope done, or for pre-op, for surgery where they don't want any stool in the colon. If you're having colon surgery or gynecologic surgery, we would often give mags, some kind of magnesium citrate preparation. It's called a bowel prep, okay? It's usually treated in lower doses to treat constipation to induce a bowel movement. So mag citrate, it will raise your blood levels. However, be careful. If you take too much, it can induce diarrhea. Okay. Magnesium oxide, totally different form. Mag oxide is typically used to mag oxide is not used to raise magnesium in the blood. Mag oxide is not used to raise magnesium in the blood. It is poorly absorbed. It has low bioavailability. It is used to treat heartburn, and it is used to treat indigestion and constipation. It is the active ingredient in milk of magnesia. Okay, so if you have low blood levels, drinking milk of mag probably will not raise them, but it will give you diarrhea or improve your heartburn, or it's used for gastrointestinal purposes. See, very, very different than the mag citrate. Great bioavailability, lots is absorbed. It also induces diarrhea. The mag oxide, not really well absorbed, however, will give you relieve heartburn and induce diarrhea as well. So mag chloride, another form, it is well absorbed also into the digestive tract, and it's a great multi-purpose supplement. You can use it to treat low magnesium levels, heartburn, or constipation. It's most frequently taken in a capsule or a tablet, but sometimes used topically, like in lotions or ointments. Some people use it to try to soothe muscles, but there's not a lot of scientific evidence to prove that actually works, so be careful. Number 4, magnesium lactate. Magnesium lactate is utilized a lot as a food additive to neutralize the acidity in foods. It's easily absorbed, and it can be a little bit gentler on your gastrointestinal system, and it is particularly significant for people who need to take a lot of magnesium regularly and don't tolerate a lot of forms. So it's kind of a secondary form that's used if people are having side effects from the other forms of magnesium. Mag lactate may work a little bit better. Let's see, and then mag malate. It's very well absorbed into the gastrointestinal tract, making it a great option for replenishing your magnesium levels. It's also gentler on your system and less of a laxative effect. So for people who are having chronic diarrhea with the common supplements that are given, mag malate may be a better option for them. Okay, and then mag taurate. It's got some different, it actually helps to promote healthy blood sugars, and it can lower your blood pressure. So the other mag supplements have not been shown to have those properties, but this one, mag taurate, healthy blood sugar levels and support a healthy blood pressure, which also supports heart health. Mag taurate. Okay. This one everyone asked me about. I had to do special research on it. I was so impressed with the research. This is the one I take. So get ready. Get your pencils out. Are you ready? Magnesium L-threonate. Magnesium L-threonate. It's the salt formed by mixing magnesium with threonic acid, a water-based soluble substance derived from the metabolic breakdown of vitamin C. It's easily absorbed, and it is the most effective type for increasing magnesium concentration in brain cells. Okay, magnesium L3 and 8. It's often used for its potential brain benefits and may help manage certain brain disorders such as depression or age-related memory loss. More research is needed on this, but the research I've seen is pretty impressive. It's also got some, really good indications for anxiety. So I am taking it to bolster my magnesium levels in my brain so that it can help me with sleep and it can help me with look at me, I can't even remember, memory loss. Must not be doing a great job. Okay. And then finally, mag sulfate. Okay, magnesium sulfate is basically what Epsom salt is. Magnesium sulfate is frequently dissolved in bath water to help soothe sore, achy muscles and relieve stress. It's also included in a lot of skincare products. Magnesium levels can play a role in muscle relaxation and stress relief, but there's very little evidence that this is well absorbed through the skin. So a lot of you, I've seen comments on my other TikToks or posts about magnesium saying you take bath salt, you use your bath salts. Well, actually, it's not really bioavailable, like I talked about earlier, when you get it absorbed through the skin. So, and then let me talk about one more, magnesium glycinate. It's often used as a standalone dietary supplement to improve sleep and treat a variety of inflammatory conditions such as heart disease and diabetes. Magnesium glycinate is easily absorbed and may have some calming properties. It may help reduce anxiety, depression, stress, and insomnia, yet scientific evidence on these uses is limited and more studies are needed before people will really sign off on it. So, if you don't have low magnesium levels, there's no evidence that suggests that taking a supplement will give you superpowers, will give you any measured benefit. Okay, so everyone asks about supplements. There's not a lot of supplements out there that show that taking super physiologic doses will give you superpowers. You want to supplement most vitamins, minerals, and nutrients if you're not getting enough through your diet or if you have a documented deficiency. So don't forget, I talked about this earlier, there are foods that are the best initial ways to get the magnesium. You always want to get your nutrition from food first. So like I talked about before, I listed some, but in general, legumes, black beans and edamame are great sources as well. Vegetables, spinach, kale, and avocado, nuts, almonds, peanuts, and cashews are really good. Whole grains such as oatmeal and whole wheat, and of course, dark chocolate, as I talked about earlier. Everyone gets super excited when I talk about that. So if you are coming in late to this video, if you're on Facebook, if you're on my at the Galveston Diet Facebook page, you can review this video from the beginning where I talk about magnesium deficiencies and what those syndromes look like. And then I went through several magnesium supplements and talked about their medicinal uses and some of their side effects you need to be wary of. Okay, so I'm going to answer some questions now. So give me a sec. I'm going to do some Facebook questions, then I'm going to do some TikTok questions. Okay. Oh, let me go find my questions. Hang on, y'all. Okay. Did I say magnesium L3 and 8? Yes, I did. What about mag glycinate? I didn't talk about. Did I talk about that one? Let's see. Good morning. Love that you share such great information with you. Magnesium, can we get it over the counter? Yes. Almost all magnesium formulations you can get over the counter from your local pharmacy or even a grocery store. Let's see. All right, let me go to TikTok. One second, guys. I have these cameras set up kind of weird. Will the magnesium L3 and 8 still help with constipation? Probably not. Remember, it does not induce, it's not a laxative like the others. Let's see. If you have a question, guys, on TikTok, don't put it in the comments. They scroll by and I can't go back to them. There's a box at the bottom that has a square and a question mark. Put your questions there. Does menopause cause whiskers on your chin? Well, it's a little bit off topic. We're talking about magnesium today. But yes, menopause can definitely, we do see androgen-related increased hair growth and definitely whiskers, the thick vellus hair, the thick terminal hairs that suddenly appear out of nowhere. I definitely have one on my chin. can. And what happens is, and I talk a lot about this in the Galveston diet, and it's kind of the backbone of the nutritional choices that we make. But when our estrogen levels drop, we have a relative rise, relative meaning the actual levels of our androgens really don't rise, but they become more active. One, because estrogen kind of suppresses their activity, and two, because our steroid hormone binding globulin, the protein in the blood that binds these hormones and keeps them inactive and then releases them when they need them, goes down. So you have more free and active androgens, male-type hormones, floating around in your blood with menopause, okay? Those male-type androgen hormones are what starts driving the fat deposits to our abdomen, what starts the cholesterol changes, what starts the heart disease changes. Also, it starts having the hair loss sometimes here for some of us, and the hair growth in places where we don't want it. We lose hair where we want it, and we gain hair where we don't want it. Okay, hopefully that answers your question. So where do you find magnesium L-threonate? It's THRENOATE. I got mine from Amazon. I just looked for a reputable brand, and I did it from there. How do you find a good supplement, guys? It is hard. Finding a good supplement is not easy. Why? Because the FDA, because they're food products, and the FDA doesn't regulate them. It doesn't regulate the company. It doesn't regulate testing like they do for drugs. So a company, Bill and Fred can make their own magnesium supplement, slap a label on it, put it on the shelf, and they don't have to prove what's in it to any government regulatory agency. They don't have to have it tested by a third party. They can, and this happens all the time, they don't have to guarantee how fresh it is, how active it really is. They don't have to test it because it's food. And so you have to be very, very careful, because you can become toxic on magnesium if you take too much. There is such a thing. So you have to do your own research. There's thousands upon thousands and thousands of brands out there. So you have to be your own advocate here. Look for third-party testing. Look for a company that uses third-party testing. Okay, go on their website, ask before you buy. So make sure that what they say is in it is in it. Go to Google Scholar and do your own research as to what formulation of magnesium that they're using, or whatever you're trying to find, and what that particular type is used for. Remember, some are used as laxatives, some are not absorbed in the GI system. Mag oxide will not raise your blood levels. Okay? You've got to educate yourselves on this. Don't just take things blindly or go with whatever other people say, or an MLM company or whatever. This stuff is not tested. So sorry. Anyway, I love talking about this stuff. You can tell how passionate I am. All right, I'm going to go to some more questions. Is magnesium something that is normally tested in annual blood labs? That's a great question. So here's the deal about magnesium. It's not stored in our fat like vitamins K, A, D, and E. So you can be low for like a day. And so when you're having a blood level tested, it's just kind of where you are in the moment with your magnesium. It's not really a good representative of where you've been for the month or where you've been for the year. Okay, just because you're low today could just be that you're having a bad day, and not that you've been low forever. And so my best advice to you is to, again, be your own advocate. Take the time to track your nutritional intake. It's what we do in the Galveston diet. It's what I recommend. Track it for a week or two. Go back and look at all of your vitamins, minerals, and nutrients and see where you're falling short with your diet, and then supplement, okay? And then supplement. Taking super physiologic doses of things will not give you superpowers and can give you toxicity. So be very, very careful. Let's see. Watermelon is a great source of magnesium. I have to look that one up, but I'll take your word for it. Have I tried Magtein? You had mentioned it before. I just bought it, and I believe I noticed a difference. I have not personally tried Magtein. I don't know what's in it. I don't know which formulation it is. If you are on dialysis, you need to talk to your nephrologist before you take any supplement, because all bets are off. Again, you should be working hand in hand with a registered dietitian. If you're on dialysis, you should meet with her at least once a week. She should be reviewing what you're eating. If that is not available to you, call your nephrologist now and ask for one. Okay. All right. I'm not taking I don't know what Magtine is. I'm taking magnesium L-threonate, the generic brand. Maybe that's Magtine. I don't know. So, okay. Let me go to more questions. Hang on one second. No, I did not cover this one. I don't even know what that is. That is, let me look it up. Hang on one second. Give me 1 minute. I will look this one up because I have never even heard of it. Magnesium bisglycinate chelate. Okay, 1 second. And then I'm always going to go to scholarly, so I can go to a peer-reviewed medical journal article and not something someone with just randomly wrote. Scholarly articles. Okay, magnesium bisglycinate chelate. Oh, okay, so there is an article. Opinion on, this is an opinion. There's very, very little on this particular formulation. So here's an article from Nutrients, which is like you want to know about nutrition, you go to the Nutrients. I mean, this is a medical journal named Nutrients. So anxiety. So this was specifically existing evidence is suggestive of a beneficial effect on MAG on subjective anxiety in vulnerable patients. However, the quality of the existing evidence is poor. So they were using a formulation called, give me a sec. That was a glycinate, but I don't know your particular bisglycinate chelate. It's not even in like the normal medical literature. So I don't, if you can find an article, I would be happy to review it. Okay. Tabor. Hey. Uh-huh. Thank you. Awesome. Okay. Sorry. I was on break. It was just a quick question. Let's see. How about if you're on dialysis? What do I work? Okay. What are my favorite brands for supplements? I kind of spread that business around. I mean, I feel like certain companies are really good for certain supplements, and others, got famous on one supplement and then just kind of made a bunch of other crap and aren't as good. But again, there's a lot of pseudoscience around nutrients, and you have to be really, really careful. And so make sure they have third-party testing, do your due diligence, make sure you're taking it for a reason. Don't expect superpowers. These deficiency syndromes are real, but they aren't for everyone. Just do your, due diligence. Okay. I have put on so much weight since menopause. I literally hear this day after day after day after day. So what I do in the Galveston Diet Signature Program is I educate you. I educate you why this is happening to you, so you understand the science, the biochemistry, the pathophysiology of why we have sudden increases of weight gain with our hormone changes associated with menopause. Then I give you some nutritional evidence-based ways that you probably have not thought about before or tried, utilizing an anti-inflammatory approach to nutrition, because what's happening as a result of our hormones changing is we're having a rapid acceleration of our chronic inflammation levels in our body, which is leading to excessive abdominal fat gain and therefore weight gain, especially in women. And so I make sure you understand why this is happening to you and what is the net effect of nutritional choices that you can utilize to make those hormones start working better for you. Again, I'm not just talking about estrogen, progesterone, and testosterone. I'm talking also about insulin and cortisol, the hormones that control where and how you store fat, and also leptin and ghrelin, the two hormones that control whether you're full or whether you're hungry. And I'm going to teach you the nutritional hacks to make those work for you. The end result of the Galveston diet, for me, the most important thing is that you are healthier. that we have changed your risk factors, that we have changed your risk of long-term chronic disease, that you can play with those grandbabies when you get older, that you can take those trips when you finally get to retire, if any of us ever get to retire, that we're not dependent on our children or caregivers to take care of us when we're older, that we are kicking booty at 80, and that I can do with nutrition. So we can lower chronic inflammation, and we can lower the risk factors associated with chronic inflammation with good nutrition, which is a very misunderstood topic in the United States. Okay, we can lower your risk factors of heart disease, stroke, diabetes, and cancer with good nutritional choices, and that is my goal. Pleasant side effect of all that is typically weight loss if you're overweight. So if you're suffering from weight gain and menopause and nothing you've seen to have tried is working, please try the Galveston diet. We have 54,000 students enrolled in the program. We have helped thousands upon thousands upon thousands of women get through this phase of their life as healthy as possible. We have thousands of success stories, and I would love for you and to invite any of you to become one of them. You can learn more at galvestondiet.com. You can follow me along on TikTok to pick up lots of tips and hints and tricks. You can follow us on YouTube. We have a good Facebook page. Sorry, my daughter keeps texting me funny things. Anyway, but OUR. Let's see. Is bulletproof coffee allowed on Galveston Diet? Okay, we are not a keto program. If you are looking for a keto program, you need to look elsewhere. Will you ever be in ketosis on the Galveston Diet? Possibly. Is it something we track? No. Is it something we worry about? Not at all. Bulletproof coffee is specifically for keto, okay? Putting butter or cream or something in your coffee may not break your ketosis, but it will break your fast, okay? Fasting don't confuse fasting with keto. We are a program that utilizes fasting for the health benefits, which are going to blow your mind when I review them with you in the Galveston Diet. It's insane. Modest weight loss with fasting, really. Fasting is not the greatest way to lose weight. We have a different mechanism for weight loss, but the health benefits of fasting are insane. And so if you want to nothing is not allowed on the Galveston Diet. It's us educating you and you making the best anti-inflammatory choice for you and what fits in your day. But keto bulletproof coffee is going to give you a lot of saturated fat, which is very inflammatory. So you're shooting yourself a little bit in the foot there. And it's going to break your fast if you have it in the morning before your fasting window is out. And that is also going to limit your health benefits that you could be maximizing with following the Galveston Diet the way that we planned it. So hopefully that helps. Can mag citrate make you dependent for constipation? I have to look. I want to say I learned in med school that people who take laxatives chronically can become dependent on them, and I'm pretty sure mag citrate's one of those. So you got to be careful. Most gastroenterologists will, depending on the cause of your constipation, because there's many, if you're doing an over-the-counter laxative, it is something you want to take on a very as-needed basis, not something, if you're needing something every day for constipation, you need to go to the doctor and get evaluated, and preferably a gastroenterologist who has some expertise in this. Is tea okay on a fast? So black tea, yes. Black coffee, black tea, water. Some people do put things in their water like lemon peel, orange peel, lemons, peppermint leaves, mint leaves, basil. I've seen rosemary, cucumbers, anything that kind of infuses a good flavor into your water is absolutely fine. Some people do sparkling water. That's all good as long as there's very little, almost no calories. So coffee will have like 2 or 3 calories per cup because the oil sometimes, but we're not adding anything to the coffee. Some people will add cinnamon or nutmeg to their coffee grounds, but that's about it. Okay, I'm answering questions. Okay, let me go to Facebook. All right, let's see what questions you guys have. What about magnesium aspartate? I have not seen and I did not do a thorough, I did a pretty thorough on the most common forms of magnesium supplements. So I have not looked at that one, so I cannot comment. And if it didn't pop up on this Google Scholar, then it's probably not recognized. So buyer beware. How do I like the brand Pure? Never heard of it. I guess Magteen is magnesium 3 and A. Mine just, I have to look. It's at home, and I'm flying to California. I'm on a 24-hour shift, and I'm flying to California tomorrow, straight from the hospital. So, and I just dumped them in my Ziploc. So I don't know the brand right now. I'd have to go back to Amazon and look. What is the best time to take it? I take it at night before I go to bed. But no one told me to do that, and I have no data to back that up. I just want it to help me with sleep, and so I take it at night, so I'll have my highest level right as I'm going to sleep, my highest blood level. Can you take more than one magnesium supplement? I guess if you, that's a tough one. None of the studies showed taking multiple supplements. Remember, you can get toxic on it. So it's like, what are you trying to treat? Why would you take more than one? So I would be very, very careful. Remember, don't look for a miracle drug. We're just trying to replace things that might be deficient so that you get the maximum health benefit. Is it likely to start menopause at 39? Okay. So we have normal estrogen, progesterone function, normal ovulation, normal hormone levels in our reproductive years, and then we have menopause. The time period to get from here to here is called perimenopause. That is the beginning of menopause. So menopause means your periods have stopped, secondary to, not surgery, secondary to decrease in ovarian hormone production, okay? And so this time period is like 7 to 10 years. And it doesn't just go straight down. It's a fluctuation. As many women in perimenopause can tell you, they'll have a good month, they'll have 2 bad months, then 6 good months. Then, it's a fluctuation, but it trends down over time. So the average age of menopause, a period stopping due to ovary stopping, is 51 in the United States. 45 to 55 is still normal. Okay, period stop due to menopause. 45 is completely in the normal curve. On the edge of early, but still normal, okay? Not pathologic. So if perimenopause starts 7 to 10 years before that, do the math. Don't let a physician tell you it's impossible that you're having menopausal symptoms in your late 30s, because it's absolutely possible, okay? And the blood levels, again, are hard to detect. So there you go. You're not crazy. It can happen. Okay. Hang on. I'm coming. Looking for questions. Can the Galveston diet be done here in the UK? Yes, because the Galveston Diet Signature Program, everything we do is online and downloadable. So you don't have to have a book shipped to you. The supplements that we offer aren't available in the UK. That's it, and they're offered. They're not required. They're not part of the official diet. Okay, it's just something, if you figure out that you have a deficiency and you want to use our supplements, you're welcome to it. But you can do the signature program, you can do the coaching groups, you can do all of it. There is a value added tax from the EU. There's nothing I can do about that. So it is going to be a significant cost increase to you. But I still have lots of people who think it's worth it and have joined us from all over the world. I mean, we have a lot in the UK, of course, a lot in Canada, a lot in the English-speaking countries. Tons from South Africa. They love us in South Africa. Who knew? So yeah. Australia and New Zealand don't have the weird tax thing. So we have a lot from Australia and New Zealand because it's financially easier for them because there's not a big tax burden that goes with the EU like you guys have. So let's see, more questions. Everyone is focused on Magteen. I have read of women being able to lessen the size of fibroids after extended fasting. I've never heard of that. I've never heard of that. Please email me at success@galvestondiet.com with the medical journal article that documents that, because fasting is so good for you in so many ways, but fibroids live off of estrogen, And fasting will not lower your estrogen. It will not make your ovaries work less. So, and fibroids have got to have estrogen to grow and survive. Buyer beware. They're trying to sell you something. What kind of tests should we be asking our doctors for going in for a physical? Okay, Joe, I have a great blog about this. If you go to galvestondiet.com and you click on blogs at the top of the page, there is one just a few down that talks specifically about tests to discuss with your doctor. It talks about when to schedule your test, what time of the day to schedule your test. I mean, your annual visit, and how to prepare for it, what you need to do in order to go. You know, it's like how to maximize your annual visit. So, and then it's some tests that you can discuss, because you may have symptoms and you may have family history that will allow these tests to be done and paid for by insurance. I can't guarantee these tests are paid for by insurance. It does include inflammatory markers. There's a lot of great stuff on there to talk about, you know, and that if you can document your symptoms or your family history, that you may be able to get more of these paid for by your insurance if you have insurance. So it's, you go to galvestondiet.com and just click on blog and just scroll down, and it's going to be right. It's easy to find. Okay. Let's see. Okay, guys, let's see. And so if you, and galvestondiet.com is a great place to learn more about the Galveston diet. And then if you're TikTok or Facebook, either one, you can use the code TikTok10, TIKTOK, all caps, 10 at checkout to save an additional 10% on all the courses. So the gold and the platinum are bundled at 20 and 25% off respectively, so you can save on top of that. If you want to, let's see. All right, more. I love these questions. You guys are awesome. I'm 50 and getting my period more frequently, even though I've always been regular my whole life. Why? That could be some menopausal changes. It also could be that your body's telling you something more serious is going on and it's time to visit your doctor. If you're bleeding more frequently or heavier, go make an appointment to see your physician. Trust me, it's worth it to get evaluated for this, just in case your body is giving you your body's giving you a signal that something more serious is going on. Can someone in Texas get a consult with you? No. So I work in a hospital. I'm on break right now, and I do 12 or 24-hour shifts, basically. And I work on an emergency basis. So I cover the OB-ED, which is the OB. We have our own ER in labor and delivery. So I cover anybody who comes through there. Every single patient who comes in, I evaluate them. I cover the ER, so anything gynecologic, ectopic pregnancy, anything cysts, varied cyst, anything comes through the ER. GYN related, that's me. I cover all the consults in the hospital. So like someone's in ICU for, COVID or whatever, and she's having bleeding at 65. They call me to go see her. Someone, so I work as, it's called hospitalist. So I work as an OB-GYN hospitalist. I no longer have clinic. I cannot do one-on-one consultations with the Galveston diet because my malpractice carrier will not cover that outside, so as long as I'm practicing in a hospital, I can't do one-on-one coaching. That would be considered a doctor-patient relationship, and I can't do that. So, sorry. But I do have Galveston Diet certified coaches who help me run our coaching programs. So I can do group coaching, but I can't do one-on-one. And if you want one-on-one, we do have a very highly educated Galveston Diet certified coach who does it. She's fabulous, but she's pretty booked up. So you have to get on a list to be able to talk to her. Okay, let's see. So for those of you who are joining late, I did a whole talk about magnesium and magnesium supplements and what magnesium deficiency syndromes look like. If you're on Facebook, you can just watch the replay from the beginning. For those of you following me on TikTok, there's no replay here, but you're more than welcome to go to the Facebook page and watch it from the beginning. I did a very long discussion about the different forms of magnesium that are out there, what their medical uses are, what they're not used for, and what the side effects are. I also talked about magnesium deficiency syndromes and the foods that are rich in magnesium. Thoughts on synthetic estrogen and progesterone, HRT. So the decision for a woman to go on hormone replacement therapy is an individual decision between a physician and the patient. mostly the patient. That decision is based on your age, your risk factors, your family history, your symptoms, and what your goals are. Okay. Now, then if you make the decision, okay, I want to go on HRT. I feel like this is a good option for me. What you have to be aware that there's lots of different formulations. So there's formulations as far as what they're made of chemically. So there's synthetic, and there's the ones that are plant-based, okay, which are also called bioidentical. Okay, they have the same risk profile. Risk of cancer is the same. Risk of blood clots are the same. Risk of stroke is the same, regardless of which formulation you go on. Don't be lulled into thinking that one is safer than the other. Some may be easier to dose than the other or have more options. Okay? Pellets are not FDA approved. They are kind of done rogue by clinicians, and they're very hard to dose, and once it's in, you cannot take it out. Okay? Buyer beware. Other than pellets, there's other ways to get it. You can do patches, which is what I use. I use a synthetic patch. There are rings you can put in the vagina, which are super convenient and easy, but they're very, very expensive. So most people choose another form. I love them. I think they're amazing, but I choose to spend my money on different things, and I just do a generic patch. There are pills, of course, traditional pills. Now, when you take oral pills, you do have the liver, you have to go through the liver in order to get it. So with liver disease, that may not be an option for you. There's pills, patch, ring, shots. There's some people still doing injectables, but they're all considered to have similar safety profiles. Dosing may be easier with different doses, because with some of the synthetics, it's very rigid. We have this dose, this dose, this dose. With some of the bioidenticals, you have a little bit more leeway in dosing the medication. So again, individual decision between you and your physician, and your physician should be able to discuss all of the options with you and not just give you one option. If they're only giving you one option, you need to ask why and how much they're personally profiting off of this option. Just saying. All right. Okay, my break is just about over, and I need to go. Love talking to you guys. We'll talk again soon, and everybody have a great day.